what are the challenges in processing a radical prostatectomy specimen? What are the problems or what are the challenges most important compared to other cancers which a radical prostatectomy specimen has? Can you think of
Check
some?
for extra prostate extension.
No, I mean challenges in like
Mm,
when dealing with a prostate specimen, what
mm.
difficulty does a pathologist faces compared to a RCC, compared to a bladder cancer, compared to a penile cancer? What is the problem with a radical prostatectomy specimen that they have to be very careful in processing it?
Not sure, sir.
Okay, we'll come back to this. So, how do you weigh the specimen? How the specimen is weighted? Because the gross description
Mm.
of the specimen includes the weight of the specimen as well. So, how do you weigh the specimen?
No idea, sir.
Okay, so fine. So, so what are the details you will expect from the pathologist? What are the details from about the disease you will expect from the pathologist?
Uh, Most important Gleason grade, primary Gleason grade, secondary Gleason grade, extra prostate extension, seminal vesicle invasion, margins positivity, that is focal or diffuse, lymphovascular invasion, lymph nodes positivity, how much of lymph nodes is positive.
Just about the specimen, right? Right. So you
That's
know about the Gleason. So if you get this kind of picture in the Gleason, sorry. So can you tell me what Gleason is this? What do you mean by a Gleason score?
architectural structure of the cells.
Perfect. It's an architectural uh, pattern of these cells. So can you tell me what Gleason group is this? What Gleason grade is this?
Maybe 3+3 or 3+.
Sorry, two? I mean,
Maybe 3+3, sir. 3+3 maybe. Well, that's
what makes it?
looks.
What is the characteristic feature of three? What is the characteristic feature of four? And what is the feature of five? Can you tell me what
All
is the?
got. Um,
It's okay. So you sometimes you can be unlucky and might be given a histology slide also. So that's
okay.
to have a discussion. I've kept this. So and so you want to still stick with three?
Not sure, sir.
Okay, fine. So suppose you find a margin positive in your
Mm.
specimen. Like what would be your next step? What would you like to do? This patient
Because if
goes
it's
4+4 with a margin positive, right? So
mm.
what is your plan? What would you do?
Whether it is a focal or diffuse margin positive, sir.
It's just a focal margin positive.
Uh, we have two options. One is explain the patient about the margin positivity and keep him under close follow-up with the serum PSA monitoring. Have a lower cutoff of zero point 0.1 for him rather than zero point 0.2. Other one is offer him yearly uh, RT.
Okay. So you want to keep the patient on surveillance, right?
Yes.
So what are the indications of an adjuvant treatment after radical prostatectomy? One more question I just want to take before I start the discussion. So when you talk about Gleason 4+3 or 4+4 or 4+5, what do you mean by this first four and the second number? What is this number plus this number? So what is the first
Primary,
and the second number?
primary number, primary number is the most common one.
Yeah.
Secondary one is the highest pattern seen.
Even in a biopsy, like this is a radical prostatectomy specimen we were talking about. So
Yes.
in a radical prostatectomy specimen, is it the same pattern, like same thing that you are saying, most common and the highest grade for a radical
Yes, sir.
prostatic specimen? So is it different in a trust biopsy specimen? Suppose you have done a prostatic biopsy and again you get something plus something. So again, is it most common and highest grade? Or is it different here or is it different here?
In radical prostate, we get the tertiary pattern also.
No, no, let us first talk about primary and
Oh,
secondary. Just talk about
okay.
primary and secondary. Is it the most common and high grade in both the trust biopsy and radical prostatectomy, or is it different? Others can write in the chat box.
I think most same only, sir. Not sure.
No, it's not same. So if it is different,
Okay.
which one would
Hmm.
be what? Okay, let us take up all these questions quickly. So all these are typical questions which you get, and I want you to be confident in answering them. So there is a logic why. So in radical prostatectomy, it is most common and second most common. Okay, most common pattern and the second most common pattern. In trus biopsy, it is the most common and the highest grade. Most common plus the highest grade. Why it is so? So in a trust biopsy, even if the pathologist is because we did just samples, we just get tissue samples. We and if the pathologist is getting a grade 5, even it is a very small area, he has to mention it because that might be actually a large area which has not been biopsied completely. So you don't want to miss the possibility of a high grade cancer in the actual specimen or in the actual staging if you don't mention it in the trust biopsy. So in a trust biopsy, you have to be over careful, or you can just over grade the patient because you just take a sample of core from there from that area. So if you have most common 4, so in most of the cores 4, you definitely mention it. But if you find there is 3 in 1 and you 5 in 1 or 3 in 2 and 5 in 1. So if suppose 8 cores are positive with 4, so you'll mention 4. If you find 3 cores are positive for 3 Gleason 3 and one score you can 5 Gleason 5, you still write Gleason 5 because it is the highest grade that you have, and you have to tell the surgeon that this could be a higher group grade group disease and be prepared for the surgery with that high grade intention. Okay. So in your trust biopsy, you always do a most common plus high grade. In your final histology, you don't want the highest grade. You just want the most common and the second most common because you have removed the whole tumor and you know they have processed the entire specimen. They just want to address the most common and second most common. If there is a tie or if the other third most common tertiary pattern which you are saying is there, which is quite significant, more than 5%, you mentioned that also in the histology. Are you understanding, Venkat? So
Yes, sir. Yes, sir.
second most common when we go for in radical prostatectomy specimen. In the trust
Yes, sir.
specimen, it is always most common and highest grade. And
Yes,
you
sir.
will be asked on this. Trust me, this question will be there in your viva in some of the stations, either in specimen, in operatives, in whatever scenario you face, this will be there in your viva. And
Yes,
everybody
sir.
has to be very clearly able to convince to the examiner what they are thinking. Okay, this is absolutely written in the Campbell also.